Hello everyone, my name is Gerhard, and my presentation will be about preoperative functional capacity assessment. I'm a PhD student and my supervisor is Professor Milton. What are the challenges of preoperative risk assessment? Are more exams needed for these patients? If we ask for more exams, it will increase healthcare costs, and perhaps it will lead to procedure delays. Is postoperative ICU care necessary for this patient? If we ask for a postoperative care, it will lead again to increasing healthcare costs and perhaps inadequate distribution of ICU beds in this hospital. A low functional capacity is known to be associated with the severity of many diseases like diabetes, heart failure, COPD, coronary artery disease, and peripheral artery disease as well. So, if it is associated with the severity of these diseases, and some of these diseases are associated with more complications in the postoperative period, perhaps assessing the functional capacity can be a good predictor of complications. And how can we obtain the patient's functional capacity? Basically, in two forms, by estimating and by measuring. The estimation can be done by validated functional assessment questionnaires, by asking the patient about his capacity of climbing 2 flights of stairs, walking 4 blocks, or walking up a hill. And the gold standard, we can measure the functional capacity by a cardiopulmonary exercise test, which, although it's a lot better, it's more expensive and not always available. Perioperative guidelines suggest that the patients that have an estimated functional capacity of more than 4 mets, or a good functional capacity, they don't need further complementary exams. The literature, however, brings us some controversies. Some of the studies show that a higher measured functional capacity is associated with less complications, and a higher estimated functional capacity also is associated with less complications. However, some studies question the patient's ability of estimating their own functional capacity. And the literature on estimated functional capacity for assessing perioperative risk is a little bit scarce. And we also question the validity of all those studies that were performed for Brazilian population, because most studies were performed in the United States, Canada, and Europe. What are the aims of our study? We want to create a functional capacity questionnaire with cultural adaptations. We want to measure the precision of those questionnaires by comparing them with a gold standard test, which will be the cardiopulmonary exercise test. And we also want to assess how much the schooling of patients interferes with their ability to estimate their own functional capacity. Are the patients with more study able to estimate better this functional capacity? Thank you for your attention.